So I just want to say hello to the Kershaw County School District and our community. This is the second iteration of our soup chat where we're going to demonstrate our PPE. I am blessed to be joined by our fourth grade team here at Wateree Elementary School. And as you can see, some of them are wearing the face shields that they'll be using during the school day. And then we have some of our awesome Wateree Elementary School students here with us and participated in our press conference with the governor. So we talked about what it was going to potentially look like in a classroom with students socially distancing and wearing face masks and taking face mask breaks. But I also wanted to share with the community some of the PPE or the personal protective equipment that the district has purchased, largely in part from the money that we're receiving from the state, but also from what we're chipping in as well. We have a variety of things that will be available to our teachers. One of the things that we have is, obviously you can see the face shields. All of our students will be wearing face masks. We also have goggles that will be available. We have disposable masks. If you are visiting the school district and you do not have a face mask, it is required for you to enter our buildings, and we will have those available. We also have a product that we're very happy with. It's called Covalent Clean, and it kills about 99.8 to 99.9% of all bacteria and viruses, to include COVID-19. And then the other thing that we're really excited about is our fever system that will mass screen people who enter our facilities. What happens is you'll have a little green or a little red box that will surround the head of the visitor, whether it's a student, a staff member, or a visitor. If that box turns green, then they're good to go and they're within limitations. If it turns red, then we know they have an elevated temperature, and we'll move them to our isolation room for further evaluation by our school nurse. So thank you for watching. Hopefully the footage of how we're going to use the entry system and the isolation room will be of benefit to you. And we look forward to September 8th when all of our children come back to school, and we offer both virtual and face-to-face instruction. And we also look forward to August 24th where our teachers are going to be back at it full-time with the Leap Week. So thank you again.
What the media is telling us about the virus, I feel like there's always so many different, you hear different things from different sources, and they all seem to be conflicting.
It is hard to know exactly who to trust and who to listen to.
I think anxiety is high in children right now because everybody's acting a little stressed out, but I also think that they're learning smart ways to stay safe and be healthy, getting better at washing hands.
This is creating a nation of upcoming hypochondriacs.
I hate to say the new normal, that just sounds awful.
Well, it better not be new normal. So I am worried about this new normal.
I don't think they understand how different it'll be at this point. I think that they think they're going to go back to school and it'll just be normal, and that's not how it's going to be, and that does also worry me.
The high wire, probably thinking to yourself, I don't want to put my kid into the middle of this where they're being rushed out of school or forced to wear masks or plastic, shields up because some teachers freaked out, or a principal or a school or a governor. I'm not putting my kids in a mask. I'm not going to keep them from touching each other and telling them that's not allowed, no ring around the posy this year. But, for all of us, we're grappling with this issue.
Dr. Barkey is joining us.
Dr. Jeff Barkey joins us now with his message.
I'm a board-certified primary care doctor. I practice in coastal Orange County. I've been doing so for over 25 years.
I'm here representing thousands of physicians across the country whose voices are being silenced because we don't agree with the mainstream media and the experts who are telling us what to do.
This is a very deadly disease if you are in a high-risk group, but you should contrast that with the young and the healthy. And in the young and the healthy, this virus is no more deadly or dangerous than a bad seasonal influenza.
When kids get COVID-19, first of all, they either have no symptoms or they usually have mild symptoms at all.
I've treated personally multiple COVID-19 patients, and thank goodness none of whom needed hospitalization and none of whom have died.
It's time to get kids back to school.
The pandemic has sent us. I want you to know up front that we are making every attempt to provide the very best experience possible for the children of Kershaw County. I have shared and will continue to share that our keys to success are to continue to remain educated on the most up-to-date data and guidelines on best practice.
Dell, so much to talk about, so little time. The parents are terrified because they're taught to be terrified because they're watching too much of the mainstream media. They're, of course, worried about the health of their children. I've got 2 kids. Nothing keeps me up at night than worrying about them and anything that has to do with their health or well-being. So that's what frightens parents, is their concern over the health of their kids.
Thank you for all your support we have received and continue to receive throughout this pandemic. We remain focused, and our resolve to do what is both best and safe is unwavering. We will and are KCSD strong.
What they don't know is that their kids are at much greater risk every year of seasonal influenza than they are of COVID-19. Their kids are at much greater risk of drowning over the summer than they are from dying from COVID-19, and they've got about a 50 times increased risk of dying in a traffic accident coming to school than they do with anything related to COVID-19.
What are recommendations you're making to your parents right now as they come in, to try and help them deal with this concern and their fear? What do you tell them?
I tell them 3 things. Number 1, stop living your life with fear, turn off the mainstream media, and live your life free with some common sense precautions. So of course, don't go into real crowded areas. And if you have to, putting a face covering on yourself as an adult makes sense, never makes sense on children. And use good technique for washing hands and sanitizing. All that makes sense. But to live your life in fear makes no sense at all. I wrote an article about this, fear fatigue, recently, that you can find on my website, rxforliberty.com, rxforliberty.com. We need to stop doing this. We're driving ourselves crazy. Suicides are at a higher rate than deaths from COVID-19. We're seeing increase in depression. We're seeing increase in domestic violence. And most importantly, we see reporting for child abuse down by 25%, not because the abuse isn't happening, it's because our frontline reporters, teachers, and even healthcare professionals are not reporting because the kids aren't going to school.
Wow,
and
that's
just dangerous.
Absolutely. So, as we sit here and have this conversation, I know there are people that are watching. Our audience is exploding. Every week we're growing. They're wondering, why is the High Wire being censored? Why did the YouTube channel come down? What is this guy saying on the High Wire? What kind of doctors is he bringing on? But I want to address, there's a fairly big story that's starting to sweep the country. I thought Sacramento Bee covered it really well. Let me just read a couple of the headlines here. The Sacramento Bee says young kids carry 100 times more coronavirus in their noses than adults. A study finds. New research says children younger than 5 years old can hoard up to 100 times more of the virus in their noses than older children and adults, suggesting kids could be a significant driver of viral spread. When older children and adults had similar amounts of the virus genetic material in their noses, the study found while kids under 5 years old had anywhere between 10 to 100 times more virus in their upper respiratory tract. This study and article is getting a lot of traction around the world, and it's really leading, here you go, age-related differences, and this is the study itself, nasopharyngeal severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2 levels in patients with mild to moderate coronavirus disease 2019. Now, the thing with this study and this article is it's really bringing up a bigger debate. They say, well, fine, Dr. Scott Atlas can say the children may have very little effect and they could go back to school, but what about the teachers? The teachers are in grave danger because science is showing us these kids are actually super spreaders, is this term we're now hearing. You've looked at some of the science, especially this study. What should we be looking at? Or is there another way to see this headline or understand it?
Dill, this makes me so angry I could just start screaming at my computer screen right now. The science is bogus.
So let's take a step back, first of all, and remember within hours of each other, two of the most reputable medical journals in the world, The Lancet and the New England Journal of Medicine, had to pull down bogus studies. I've never seen that happen ever in the history of these two journals. This study that you're referring to was published in JAMA, another reputable medical journal. The problem is it's a bogus study, and here's why. They use the Abbott Laboratory COVID testing. The Abbott Laboratory COVID testing, first of all, is flawed. There's been articles about this all over the place. Reports to the FDA that this study is, the testing from Abbott, it's fine, but it's far from perfect. This study also is not designed to quantify anything. It's a what do you call it? It's a test that says yes. It's a test that says yes or no, not how much. So what they did is they took a yes or no COVID test and they extrapolated to the amount of virus that these kids were carrying. You can't do that with this test. And that's exactly what they did. And of course, headlines all over CNN and MSNBC and all the other crazy left-wing media only capture the headlines without telling the backstory. If you read that JAMA article and the comments after, and I'm going to read this for you, analysis relies on not just a small sample, but also on primarily obtained from hospital settings. Please include additional data to quantify the actual population. The author of this journal responds to hundreds of negative comments criticizing this article. Here's what he responds. This is William Muller, MD, PhD. While it is correct that the clinical application of the assay is for qualitative detection of SARS-CoV, the cycle threshold data reported in this study were gathered for research purposes, meaning this isn't even valid data. They were making stuff up, making some assumptions to come to some conclusion, published in a journal carried by all the mainstream media to scare the crap out of people when it's not valid studies. There are valid studies, extensive study done in Germany, over 2,000 kids and teachers that showed very little evidence that kids get this illness. When they do, they have mild or no symptoms, and almost no evidence that these kids are passing it on to adult teachers. This is garbage media, and this is garbage science, and we need to stop scaring people. It is low risk for kids to go back into school relative to COVID. It is higher risk for kids to go into school based on influenza and a whole host of other things that we put up with on a regular basis. It's making my blood pressure go high. It's ridiculous that you and I are being banned on social media and elsewhere because we're telling people the truth. Enough is enough. This has to stop.
What about masks? There's a lot of these schools are saying if we open up the school, you're going to have to mask your children. You're going to have to send them into the school with masks on. Is there science behind this? I mean, what are we dealing with? You know, I put on a mask. I can feel the air moving in and out around my nose and the sides of my face, especially if I'm wearing the surgical mask. But, you know, I put on an N95 mask the other day to go to a Home Depot, and I swear to God I am gasping for air in that thing. I mean it. When they tell me this is having no effect, I am huffing. I mean, when I get it off, I literally am trying to catch my breath. I'm not making it up. I'm not running through the store. So what does this mean for our kids? What is your opinion on schools deciding whether to mask our children or not?
Del, I apologize for my heated passion. I was channeling you there for a moment, but this just really pisses me off that we're seeing garbage science being presented as mainstream media fear tactics. There is science. It's not my opinion about masks. There's science about masks, and it shows that there's almost no effect from the standpoint of masking the population at inhibiting the spread of the virus. Listen, masks are not a hill I'm going to die on. If somebody wants to wear a mask, by all means wear a mask, but we should never require a child to wear a mask. Not only is it ineffective, but it could actually be harmful. It increases learning disorders, it increases anxiety, it reduces the ability for that child to bond with their adult teacher, which is critical in the learning and social development standpoint. And not to mention that can you imagine a kindergartner, first or second grader actually wearing a mask properly? That mask is going to be a slingshot, and kids love to share stuff, including their food. And I'm sure the kid with the coolest mask will want to share it with their friends, rendering that mask completely useless. I think it's a form of child abuse to require the face coverings on a small child in a school setting. It's not appropriate. If I had young kids, I don't now, but if I did, I would never send them to a school that required face coverings, especially on the early grades. I'm angry.
You know, you've been very outspoken. You were one of the early doctors, more and more lining up, including, you know, the great event, the America's Frontline Doctors Summit in front of the Supreme Court that you took part in. You've been leading the way, but how about this new shift in Washington? We now see one of your compatriots, a doctor that has been very outspoken, speaking many of the same truths that are being shared by great doctors and scientists around the world. Is there a ray of hope here that we've got Dr. Scott Atlas in the White House now, starting to bring, I think, some reality and oxygen to this discussion on how we move forward as a nation?
Well, it's about damn time that we have a normal speaking, reasonable doctor that's part of the team. And I thank God for Scott Atlas. You know, if you just looked at his credentials that you had up a minute ago, this is a highly respected, credentialed physician, as are the America's Frontline Doctors. And so they can beat us up, and they do. Now they'll have to start beating up Scott Atlas, and I'm glad he's getting some media play because he has a common sense approach. He's been saying what we've all been saying. Enough already. Make hydroxychloroquine over the counter. The stuff works and it's cheap. Come on with the masking. Look what they're doing in Sweden. The Swedish health minister said, heck no, I'm not going to mask our society. It is the least effective way to try to prevent the spread of COVID, so we just ain't going to do it. And let's open up the schools already. Come on, enough of this garbage, fear-mongering, media hysteria. We've had enough. Yes, protect the most vulnerable. Absolutely, it's a deadly virus if you're in a high-risk group. But for the young and the healthy, it's no more deadly than seasonal influenza. So stop scaring the public unnecessarily.